CMS has updated the CPT codes for annual wellness visits for 2024. In this video, we'll discuss everything you need to know so that you can properly code and bill for this program. Hi, this is JP from ThoroughCare. Here at ThoroughCare, we specialize in helping practices manage, bill, and streamline reimbursements for value-based care programs like annual wellness visits. If you'd like a reference guide for the AWV CPT codes that we'll cover in this video, you can download one from our website. There's a link in the description below. There are no major changes to AWV rules and regulations in CMS's 2024 final rule. However, there is the addition of an optional assessment for social determinants of health. Reimbursement rates have also been updated for the year. Keep in mind that the codes are based on national averages, which may vary in your area. For exact current rate based on your location, visit the Physician Fee Schedule website. For AWVs, there are three types of visits: the initial preventative physical examination, an initial annual wellness visit, and the subsequent annual wellness visit. Each entails a different billing code as well as specific qualifiers for each program. There's also advanced care planning and the new Social Determinants of Health assessment that can be added during the initial and subsequent visit. As a physician practice, rural health clinic, and federally qualified health center, you can bill for three types of annual wellness visits. And there's an additional add-on code for federally qualified health centers only. Let's start with the IPPE, or the Initial Preventative Physical Examination. This visit is billed using CPT code G0402. This code can only be billed during the patient's first 12 months of their enrollment in Medicare Part B and is considered a once-in-a-lifetime assessment. If the patient misses the initial eligibility period, they would not be eligible for the IPPE and would start with the initial annual wellness visit instead. A health risk assessment, or HRA, needs to be completed with the IPPE. The current national average reimbursement for G0402 is $163. The next visit is the initial annual wellness visit, and its billing code is G0438. The initial AWV is practically identical to an IPPE, except for when it is available to the patient and when billing can occur. The initial AWV can only be done 12 months after an IPPE or after 11 months of Medicare enrollment if the patient misses the eligibility window for the IPPE. A health risk assessment is also completed during this visit, as well as an optional cognitive exam, advanced care planning, and social determinants of health screening. The current national average reimbursement for G0438 is $163. The final annual wellness visit is the subsequent annual wellness visit. The billing code for this visit is G0439. The subsequent AWV is the yearly follow-up to an initial AWV and can be completed 11 months after the initial AWV, and then every 11 months thereafter. The subsequent AWV is very similar to the initial AWV, with an HRA, cognitive screening, ACP, and SDoH screening. The current national reimbursement for G0439 is $128. Now, let's look at the Advanced Care Planning CPT code 99497. It's important to note that Advanced Care Planning is not a type of AWV, but it can play a role in the program during the initial and subsequent AWV. ACP is fully covered for patients under Medicare Part B if conducted during the initial or subsequent annual wellness visit. Basically, ACP is a formal process to understand your patient's preferences for future medical care. It's a great opportunity to create a plan for end-of-life care and power of attorney options. During an initial and subsequent AWV, 99497 can be billed for 30 minutes of time. It must be provided by a physician or other qualified healthcare professional. It must also include an explanation and review of advanced care directives and options for completing them. At least 16 minutes of service time should be documented. 99497 has a national average reimbursement of $81. There's also an add-on code for advanced care planning, 99498. It is for an additional 30 minutes of ACP services. A minimum of 16 minutes past the first 30 minutes must be documented as well. It has a national average reimbursement of $70 for a total of $151 for the two codes. New for 2024 is an assessment of social determinants of health using code G0136. If the assessment is done during an AWV, it is fully covered for patients under Medicare Part B. Many of the requirements are addressed during an AWV, so it is a great reimbursement to add to the service. The SDoH assessment is 5 to 15 minutes in length and should cover a standardized, evidence-based social determinants of health risk assessment that includes food insecurity, housing insecurity, transportation needs, and utility difficulties. The assessment is not designed to be a screening, but rather tied to one or more known or suspected SDoH needs that may interfere with the practitioner's diagnosis or treatment of the patient. CMS stresses the importance of follow-up or referral to appropriate services. G0136 has a national average reimbursement of $19. And finally, the last AWV CPT code is a special add-on code reserved for federally qualified health centers only. G0468 allows FQHCs to receive additional reimbursement on top of the payouts for AWVs. This leads to much higher average reimbursements for FQHCs when they provide AWV services. G0468 is billed along with the traditional AWV CPT codes. The national average reimbursement for G0468 is $228. So if an FQHC were to provide an IPPE, the clinic would bill for G0402 plus G0468 for a national average reimbursement of $391. So there you have the 2024 codes and reimbursements for annual wellness visits. If you'd like to learn more about AWVs and its rules and regulations, watch more videos on our channel or visit our Learning Center. There are links in the description below. And don't forget to download your free reference guide for the billing codes we discussed in this video. Please like and subscribe. Thanks for watching.